digitization is actually for everyone, and what we need contemporary is the healthcare sector to follow all the rest, like the industrial sectors and all the rest of the society which goes towards this process.
What we have found out is that there are many masters and many advanced courses promoting digital transformation, but there is none that makes together the effort of bringing social sciences, digital sciences, and health science together. There is a huge need of ICT professionals, of professionals from the digital sector, to work in the health sector. And this combination of skills that are needed from digital and health, having professionals that can know about the two fields of study, it's the main reason why we have decided to open this new master and to apply for this project at the European level.
So this master's course is actually embracing what technology is about, what innovation is about, and it strives for educating professionals towards this digital transformation.
We are looking for the different kind of backgrounds for the students. I think the most important is that you are interested to develop digital services around healthcare, and you're interested to have a new kind of knowledge and competence around that.
Obviously the course can accommodate students from all relevant studies like exact sciences, engineering, management, economics, anything that relates to health management and digital innovations, digital transformation.
So basically we are looking for students with various backgrounds who have an interest and passion about healthcare.
We are doing a European master. If you feel like an European student and that you have experienced already being in an Erasmus program, you can have an extra layer of attending a master that is not done by one single country, one single university, but done by a group of universities at European level. There is a huge part of the program that is delivered online, but also combined with some summer camps and some face-to-face activities during these summer camps. But I think being online gives also the flexibility, in particular for professionals, to attend it at their own pace, within their own time schedules, with also all the support that will be needed from the teachers that are involved in the different disciplines and subjects.
The added value for the students in this program, they can study together with a multidisciplinary group. It's even transdisciplinary when we try to get the students to work and go work together to innovate and develop new services.
We hope that at the end of this master program, the students will be able to, first of all, to talk with each other. So if they are coming from the digital field, that they will be able to talk to the people that are working on the health organizations, on the health sector, and to discuss how digital transformation projects can be built, can be developed, and can be successful. It's in need in the labor market, and we hope that our students will get these additional skills on the top of some technological advanced skills and also on other related topics about health organizations, health systems, and management of health systems as well.
At the same time, we learn from each other. Like Finland is one of the highest level of digitalization, and I hope that we can give some best practices also to the other countries. There is solutions like Kanta services or electronic patient record, and those solutions we don't have in all EU countries. On the other countries, of course, have some other kind of good practices what we can share. So the sharing good practices is one of the greatest idea in this master.
The fact that it's a specially designed course for those that are in need of finding out how to manage differently in different settings, in different cultural settings, in different national settings, the digital healthcare transformation. So basically it's designed for the European citizen.
you can be part of something new, what we haven't done before.